I've been the program director for approximately 5 years, and in that time period, I have looked to try to gain individuals that are teachable, someone that has not just a basic knowledge of podiatric medicine and surgery, but is willing to put in extra effort, is willing to be a person that will lead or try to lead, somebody that I can depend on. I think those are key components, because the rest, if they have those foundational aspects, we can build on that. And that's the goal. The reason I took the position in the first place is because I wanted to have an influence, not just in these young doctors' lives in medicine, but I have an aspiration to teach people to lead and also just be an influence, because I think there are so many wrong influencers out there, and I really want to see young people that, you know, as medicine continues to grow, as our particular specialty continues to grow, that they're going to continue to keep it in the right direction, and that people can continue to get quality care.
I think the biggest thing we're looking for is self-motivation. So we have certain expectations of our residents. We expect you to come in eager to learn, ready to work. Also very ambitious. We like outgoing residents, always looking for natural leaders, those who can take a situation, take it into their own hands, and be able to expand on that. Also, caring and compassion is a big thing. Here at Mercy Health, we're all about family, and we're all about developing the residents. So we want someone who's eager to learn, but also has the compassionate side and ready to care for those people in need. Something that's special about our program is, for instance, in surgery, they get the knife right away as a first year. They're not standing and watching. That doesn't happen at a lot of programs. In clinic and surgeries, they're always working up the patients. They're doing the legwork and then also participating in it as well, and they actually get to do the surgeries, get to do the clinical experience, which is nice. In some situations, you're watching a lot before you actually get to do, where we throw you in, we let you go.
This program has a lot to offer. Even though it is in Middle America, if you're not from here, it is a bit of a challenge. Like I said, I'm from Southern California, so there's an adjustment, but it's worth it. It's worth the sacrifice of being away from home and family. But realizing what they have to offer here is worth it. You get a lot of training with surgery, clinic, wound care. We also rotate with plastic surgery, family medicine, so you have a lot of exposure to different types of medicine here that you can utilize moving forward. We have the opportunity to work with different disciplines. I'm able to scrub in on cases with general surgeons as well as consult infectious disease doctor on a regular basis. Even after we do our rotation, I'm able to reach out to them, and they are encouraging and they're very welcoming. I feel like our professional input is valued. I have individuals reaching out to me, whether it be from the ED or on the floor, asking me to see a patient, or even if they don't necessarily want us to be consulted, just what my recommendations are moving forward with treating that patient. I haven't had anyone say to me or ask, well, are you sure? What does your attending want to do? They trust that whatever advice or recommendations that you're giving them, you're either confident in that, or if you do have some doubts or concerns, that you're going to take the initiative to contact that attending.
These residents, when they come, they're going to be exposed to literally, and when I say literally, there is not one thing that this program cannot offer as far as exposure in teaching them how to be proficient in surgical procedures that any other program, big or small, in the country. So when they come here, when they leave, quite frankly, they have learned and been able to have hands-on on everything that literally the specialty has to offer.
This is a program with a core group of faculty that know all of the residents and who provide excellent training every case you're in with them. You do one thing with them this case, and they say it's good, but work on this. The next case, to check on you and make sure that you're still doing better in that one regard. So it's good continual education that is specific to me as a resident and specific to all my co-residents as well. I'm always surprised when I go down to the emergency department on a consult how the ER physicians value my input as a member of the healthcare team. They treat me as a full-fledged member, they value what I have to say, and they use my input to help provide A+ care.
The biggest thing we always tell new residents that want to come in here is we're looking to develop you not only as a good surgeon, as a good doctor, but also as a person. We actually care about your family, we care about your children, we care about what you do for fun, and that all plays a part in your training. We develop them as friends, as colleagues, and I think it helps them to grow. We also develop a trust in each other, and that creates for a good learning environment. It's very calm, very easygoing.
We want residents to leave here friends and colleagues. They mean something to us, so they're not just people that are filling a space. There are individuals that we care about, and we go to great lengths to check in with them.
It doesn't even feel like I'm a resident. Truthfully, the staff at St. Rita's treats me as a colleague. When we interact, everybody's very receptive and is so willing to teach. It's a very conducive environment to learning.
I really enjoy the camaraderie of working with my fellow residents. They're all excellent people. We hang out outside of the hospital. I also just enjoy working with them professionally. I also enjoy working with our attendings professionally. They're great people, they're excellent teachers, and I honestly do get the sense that they care about me and my professional and personal development as well.
One of the more unique things that the hospital does to show its support of its physicians is that it provides a free breakfast every Wednesday morning for all the physicians, the residents included. And aside from that, we have a lot of fun academic events, but end up being rather social events as well. Our journal clubs are out at local restaurants, and while we do our academics, we also have a lot of fun while we're there.
It is important for myself and our DME leadership to show that we want our residents to be part of the family. We want the residents to understand we're here for them both on the professional standpoint and a personal standpoint. I do this on my own by allowing them to have an open door policy to come see me, but also I meet with them on a monthly basis. I want to make sure how things are going for them, what areas need improvement, and also what other tools and equipment do they need for their service. And beyond that, we'd like to bring the residents together so they can relax and have a time that will allow them to work with each other, but also team building and bring their families together. It is important here at St. Rita's that our families come together.
So the GME Center is very exciting. It gives not only an atmosphere of, hey, this is for real, but it also then has specific things. I mean, we're gonna have a completely working operating room.
I think the biggest thing with a resident is repetition and confidence. And once you develop that, then you can execute your surgical skills a lot better. So there'll be a lot of opportunities for them to go in there and actually work on limbs and actually have the experience before they go into the OR and perfect their skills.
There's gonna be ability to even bring in to the community maybe a weekend conference. It's just a place that it's going to make not only teaching easier, but therefore it's going to make with technology and just be able to have a place, it's going to make it more readily available to them.
I've been part of Mercy Health for almost 20 years now. I enjoy feeling like a family here. You come to work every day and you're happy to come to work. You feel they care for you. They go out of their way to make you feel part of the family. But beyond that, they have a ministry to go outside the community for the health and well-being of our community.
I think Lima has a lot of underserved and underprivileged people in this area, and I think it's a good opportunity for the residents to become leaders in the community and to help out. And that is our mission statement, to serve the underserved and the underprivileged, and that's why you could become a doctor. You become a doctor to serve.
Wherever you're working or whatever you're doing, it's usually about the relationships that you build and the people that you work with, and it's not necessarily, oh, I get to go to a killer building, or I get to, walk through some really awesome lobby. We do have a Starbucks, which is good, but those aren't the reasons. The reasons are the relationships and the people that we get to work with.
I think residents always want to know, what do you do, what do you provide? Lima, Ohio is a diamond in the rough. We are a very rural community, but we do everything. There is no surgical procedure they will not be exposed to here, and which is wonderful. Their numbers are phenomenal. They can compete against any top program in the country, but the advantage to our program versus some other programs is it's with a small town feel and a family environment.
My experience participating in the program has been very positive. It's a very welcoming environment. The attendings are incredible to work with. The surgical caseload is great, and the diversity is better than anywhere else I saw.
I enjoy the family atmosphere, especially being away from home. I know that if I ever have any issues or concerns, there's various people that I can go to, whether it be a co-resident or a coordinator.
From that first view that I had of the hospital and the program, I was just so surprised with the kind of things they were doing here, the amount of pathology, the amount of training that the residents were getting, how good the attendings were, and from there it was a pretty easy choice. So I ranked them, they ranked me, and here I am.
We may not have neon lights around the country, but we're okay with that because we're looking for, again, quality individuals that want to come here, that we can not just produce and get another resident through the system. We care about you, and when you come here, you're not just a number, you're not just another person filling a space, you're a person that we're gonna invest in and care about.